your brain now they control every part of your body. If you want understand stroke, you need to know say blood they enter your brain. I believe you can all see the picture on the screen. When your heart pump blood, blood go your hand, blood go your leg, blood go your chest, every part of your body. Blood go also enter your brain. Now, when this blood enter your brain, it go share to different parts of your brain. You see your neck, if you put your hand for your neck, you go to feel something they move. If you look at this picture very well, you go to see something where they move. Yes. Now your blood vessel, they carry blood go your brain. If anything do this blood where they go your brain, that blood, when it enter your brain, anything where do how blood they go your brain, if it give you problem. So if you want understand stroke, wetin we may you know to say blood they enter the brain, and this blood they go to different parts of the brain. If the blood affect one part of your brain, if it cause something where person go see with stroke. Now this picture, where we they show you, see on the front part, this front you feel think, and they make you feel tell somebody say I love you, and they make you feel plan for work, and they make you concentrate. This other orange part here, and they make you feel smell, and they make you feel touch something. You go to taste food. This other part, this where they show you this orange part, these green parts, we call them the occipital lobe. Then they make you see, and anything where you see, your brain will tell you, say, wait till you they look. So now human being they look. Now this part of your brain they control them. This other parts here, see this parts, now they help you balance. Now they help you waiting, they waka. So when somebody get problem for each of these parts of the brain, they see see this one, this one, this one, now they help your heart, they function. Now they help you, they breathe. And then this other one, see this one here. Now they help you, they remember things where you learn for class. When your teacher teach you anything and they ask you question, you go feel understand. So your brain now they control every part of your body. And blood now they carry oxygen, food go that parts. Now stroke simply means say a part of your brain don't get problem. Meaning say the blood where they carry oxygen go your brain, that part it don't get issue. Or that blood no reach there, or that oxygen no reach there. If it make person collect stroke, you understand? So whenever you hear stroke, from the very beginning, where we tell you from the very beginning, stroke means say one function where your brain they carry, that's it. Now the brain no fit do them again. With this whole definition, I want to know whether you understand what we they talk. Because if you don't understand, every other thing we they talk, it not gonna make sense to you. It clear, Abi, it not clear. Now, who fit get stroke? Anybody fit get stroke. Anybody. Young, old, fit get stroke. Yes. Pikin fit get stroke. Man fit get stroke. Woman fit get stroke. Stroke fit affect you for any part of the world. Do you understand? Fit affect anybody. But it gets how stroke fit happen. We go look and say it dey common when people don't they enter old age. You don't understand that?
Type of stroke. Dr. don't break down the meaning of stroke already for us. The type of stroke, we get 3 types of stroke. The first one we talk now is ischemic stroke. This one and the stroke when we say blood not reach one part of the brain, so that part of the brain can't die because it not get oxygen and it not get nutrients. I mean say like say there's a blockage in the artery. So because of that, blood not they reach some part of the brain. That one I would call ischemic stroke. That one is the cause when we say that there's a clot Congo form for inside the blood, inside the artery. Or sometimes clot go form for another part of the body, but blood can't carry that clot, can't go the brain. One thing when you know, we say the arteries when they follow the brain, they're tiny, small. So any little thing where you block them, it will prevent blood from going to the other part of the brain. So that's what you need to know. So when there is a clot of blood where you block them, so blood not going to flow to the other part. That one I would call ischemic stroke. Hemorrhagic stroke na the second one. Hemorrhagic stroke mean say the artery wey dey carry blood dey go the brain, when dey inside the brain wey dey carry blood dey go, e can't get injury or e can't tear or e can't burst. So when something like that happen, instead of the blood to dey go that part, e go come dey pour for every part of the brain body. So that one na dey call hemorrhagic stroke. So when that kind of thing happen, so many things then they cause that one. So people will get hypertension. That one and one kind, that like the kind of stroke when they quick get. And also it increase the pressure of the brain, so that because of that, the person, because they compress the brain itself. So when the brain don't, when there's a cut, so the brain go they splash, and that one they call hemorrhagic stroke. So the last one are transient ischemic stroke. When we say transient means sometimes. Let me use that word, a simple word. So what did happen in this case? That we say sometimes blood no dey go reach where e suppose reach. So because blood no dey reach there most of the time, sometimes that part of the brain go get small problem. But after some few time, blood will start to dey reach there. After blood no go reach again. After blood go reach there. So that one they call transient ischemic stroke. Because sometimes when during that period when blood not reach there, problem fit dey. When blood don't reach there again, that problem when we don't dey, it go stop. So transient ischemic stroke, sometimes they even they heal by itself, even when you not do any treatment. But it's not a good thing, because now sign say the ischemic stroke they come, or one strong stroke they come. So we get three types of stroke. We get the ischemic stroke. For the ischemic stroke, blood not the reach, because of say the blood, there's an occlusion, so there is a blockage in the blood flow, so blood not the reach every part of the brain. That one are one. That's ischemic stroke. The number two, hemorrhagic stroke, means say the artery don't burst, so blood is supposed to go every part of the brain, come the true way, come the pour enter other part. So that are two. Then the third one are transient ischemic stroke, where we say blood go reach the place small, e not go reach the place for some time. So now that one be the third type of stroke.
Dr. Israel don't tell us the type of stroke wey we get. Now wetin come be the things wey dey make person get stroke? Wey be say person go just sit down, this one get stroke, this one no get stroke. We wan make you understand. So open your ear and open your ear very well. Okay, may I start? One thing wey dey cause stroke well for our environment na high blood pressure. Yes, if you listen to wetin Dr. Israel talk, high blood pressure. So the artery inside brain fit just burst because the pressure dey high. That is why we dey tell people say when person get high blood pressure, make e dey take im medicine, make e dey bring the BP down. Because when the BP high well, one artery for one part of the brain, whether na the front or the middle or the back, e just burst. And when e burst, blood go dey pour. You go talk say the person don get hemorrhage, intracranial bleeding, go dey bleed inside brain. That one na one. Another thing again wey fit make somebody get stroke, diabetes. Yes, diabetes fit make the person get problem for the artery. The artery, and when e get problem, fit come lead to the person BP to the high too. Obesity make person get stroke. When person dey obese, the person fit get high cholesterol. When e get high cholesterol, inside the person artery, all those cholesterol fit dey small, go dey block the artery, small, go dey block. One day, e fit block for inside the brain. Blood wey dey enter the brain, that place fit block. And that's wey fit make person get stroke. People wey dey take substance, you know those people na oncolos, wey dey wan high. Some people wey get heart problem, the heart problem now fit come, we dey call am atrial fibrillation. No worry about the big grammar. E fit make person get stroke. Smoking, e dey increase your risk of you getting stroke. Lifestyle, the kind of lifestyle wey people dey live well, fit push them to stroke. You dey hear me so? Even accidents Somebody if you get accident right now, if he hit in head, trauma, you understand? Like you call it trauma, go hit the head, if he bleed inside the brain, get stroke. Now, if person get stroke, how you go take note? Person if he get stroke and if he get any symptom, they very, very plenty. Now, your brain, they control almost every part of your body. So somebody go get stroke, the person if he gets, say, the face go weak. If you tell am make e smile, e no go fit smile, e go smile. One place go smile, the other side no go smile. The person go tell you say in hand, you no fit carry the hand up, you no fit carry the leg take waka, the hand go dey very weak, the leg go dey very weak, the person no go fit waka. Some the person no go fit talk. Make the person talk, maybe the mouth go dey bend go one side, or the person no go fit talk at all, or the speech no go dey clear. Remember, I show you from the beginning, say na the brain dey control even how you take dey talk. Some go get stroke, go get headache. Some go get stroke, e go affect their eyes, they no go fit see. Some go get stroke, e go affect their ears, they no go fit hear. Some go get stroke, the person fit see you, the person fit hear you, but the person no fit talk to you. The person dey see you, the person dey understand wetin you dey talk, but the person no fit move the hand, e no fit move the leg, but e dey understand. The only thing wey the person fit do na e go dey blink in eye. And we dey call am locked in syndrome. So the person dey hear wetin you dey talk, e dey understand, but e no fit waka, e no fit carry hand up, e no fit do anything except say e go just dey blink the eye. Person fit get stroke, the person no go fit write, the handwriting go bad. Person fit get stroke, the person no go fit even think again. Like you go tell am something, no go fit remember. So stroke dey affect any part of your brain.
One of my patients, he come hospital as we dey check am, we notice say he no dey fit talk. We go ask am, he no dey fit answer us, he no dey fit do anything. So what we did was just, okay, let's check your BP. We check your BP. The BP was high. We was like, when last you take your drug, you know they fit talk, but they try to say he want talk. They feel like he want open his mouth to talk, but he could not say anything. And then we know, say, man, now stroke this person you get, so his hand was still working fine, his leg was still working fine, but he could not make any sound. And so we quickly call a family and take him to an emergency. One thing you should know that stroke na emergency case, because you need to start treatment immediately within 3 hours of any symptom when the person they get. You need to start treatment immediately. Because what did happen now be say, because blood not they reach that part of the brain, those part of the brain don't they die. And you know when something die, it not go come back to life. So because you know want make those part of the brain die, you need to start treatment on time so that make the person still get itself back. So that those are some of the symptoms. Just know say anything will affect the brain, will affect every part of the body. Even some people say not go fit control their urine, they not go fit even hold their urine if they want piece. Even when they want go toilet, they not go fit even hold them, because maybe not that part that they affected. So this one will lead us to the kind of investigation one person need to do if he gets stroke. So one of the investigation one person need to do if he gets stroke, now to do CT scan of the brain. And when you do CT scan of the brain, to check the head, to see what and wetin they happen for the brain. That's one. Another one that we say you feel do blood test. So this blood test where you want to do now to check for clotting factor. You want to know if this person blood they flow well, or if this person blood they fit quick clot. Because if this person blood they fit quick clot, if it be saying I end up clot for one place, can't go block can't move go the brain, can't go block the brain. So that are some tests where you do. Also, you also want to try to check for if infection day, because some infection to the brain can also cause stroke. Some infection to the brain go physical stroke. So you go see do MRI for this person. You go see if you do chest echogram for this person. This one now to check how the heart stay they move, and you want to check if there is any problem with the heart, and if any blood clot did the heart as well, because when there's blood clot, as we talk, if you move to the brain. These are some of the investigation or some of the tests when person fit do to take really know which kind of stroke this person get, so that make dem know the kind of treatment wey dem go give am, because the two stroke get different type of treatment. So that make dem no go give you the type of treatment wey dem suppose give you for hemorrhagic stroke, dem go give you for ischemic stroke. E go cause more problem. E go cause more problem. So when you don't do all the investigation, you don't know the stroke, then they go come treat the stroke. Now, for the treatment of the stroke, we go always advise you go meet your doctor. So when you meet your doctor, he will tell you everything when you go do for you when it come to the treatment of stroke. And also make I let you know, say, apart from treating the stroke, there are so many other things where you still need to take care of. This one will become when we talk about rehabilitation of this person. Because when somebody don't get stroke, you need to rehabilitate this person. And the rehabilitation comes in different forms. Speech therapy mostly for people when we say it affects their mind, they not come fit talk. Physiotherapy for their hand and leg, those when you don't get weakness of their hand and leg, when we say they not fit move am. So even depression, you need to see counselors, because some people go become depressed because they get stroke. So they need to see counselors so that they can come back to their normal self. Even the kind of work when you they do, stroke will lead you to change the kind of work when you they do. Congo they do simple work so that make you not get stroke again. One thing when you need to know also is that if you get stroke before, it's not good and it is very bad for you to get another stroke, because getting another stroke now close to person to poof, like that one be. So when you get one stroke, I beg, anything where you need to do to make sure say you not get another stroke, please do them so that the person not go get another stroke.
If they look very well, somebody here they tell us say she been get stroke before. If they look the comment section and they try put say I could not walk nor talk. It was very, very bad. You understand? And it says like after 2 months, they started teaching me how to walk and talk. Now you see, say waiting with they try tell you, somebody where they listen to us right now, the person don't go through this phase. What will they do now to make sure say it no happen to us and those way we know about? If it be any sign, if you just they sit down, they look, the person no go fit talk, no go fit move, they go tell you say they don't throw the person arrow. Not be arrow, blood no they enter one part of the brain. For Africa, most times when this kind of thing happen, we go talk say na village people. Whereas you no know say the brain don't they get problem, whether they bleed inside, blood they don't burst inside, or blood no they flow which one part. Now somebody they ask us question here. He says, how can someone prevent stroke? Very, very good question. To prevent stroke, okay, I'll give you a few of them. Then Dr. Israel will give you some other one. The first one now for somebody who never get stroke at all. If you never get stroke at all, primary prevention, what you fit do? They check your blood pressure, check your blood sugar, no smoke, no take alcohol, no take substance, all those hard drugs, no take. They exercise, watch your weight. These are some of the things you can do to help you prevent stroke. Sure, you get. The person is asking us a question. Is Parkinson's disease a stroke? No. No, Parkinson's disease no be stroke. Now another entity on its own. Make we help you so that make we not confuse other people. Parkinson's disease, the main thing about Parkinson's disease, now one chemical for the brain, I get issue. Stroke on now with regards to blood supply. You understand? Blood supply to the brain, whether it don't block, so that blood no they reach the brain, or the artery don't burst. But for Parkinson's disease, na chemical, a particular chemical, no day balance for the brain. Leave it like that. Maybe we no go there. Now we have a question, a comment here. It says, it's true, I almost had stroke last year. My blood pressure was 200/130. Then cholesterol was 240, but now my cholesterol is 130. God save me. Wow, wow, congratulations. Somebody will tell you, say, I hear say person wey get stroke, they know they give an injection. Dr. Israel, you don't hear that thing before? Say, they say person wey get
Yeah,
stroke, you know they collect it.
I make one video. I make one video. I'm sorry, I make one video on that. When people they talk, say if I see stroke, they take injection. I don't know where anybody for it.
It's funny. Now, if you follow us from the very beginning, you go understand everything. This is a public health education. This is not a medical class. It's deeper than this. It gets CIA to know whether person will get another stroke. It get some kind of thing where they use the age, the blood pressure, the clinical symptoms, the duration, all that things. No be that one they tell you. They tell you the basic things where you go know about stroke. And we let you know, say, see wetin dey cause stroke. There is nowhere dem talk say person wey get stroke no dey collect injection, because this misinformation e dey spread and e dey spread. Person wey get stroke, if e need injection and na dem go give am injection, e go collect am, e no go do am anything. Now, if you dey watch us and you dey smoke, you dey take things on colos, two things can happen to you. Two things. Number one, you can stop smoking and save your life. Number two, you can continue smoking and damage your life. And then when problem happen, you come back to us and we make money from your head. So you understand? Now we are telling you so that you don't fall sick, so that nobody will make money from your head, from you, from your pockets. But if you say no, no be you go tell me wetin I go do. I go smoke, I go drink alcohol, I no go check my blood pressure, I no go control my cholesterol, and my blood sugar, I no go check am. Continue. But you know that when stroke enter, you go suffer. Your family members also go suffer. Even the doctors wey dey treat you go suffer, because themselves go dey think how to help you. You understand? So our job here na to make sure say this sickness e no near us.